Welcome now to Culture at Work on the Business Radio Network, presented by Crest Insurance, with host Matt Nelson.
So welcome everybody to today's episode of Culture at Work in Tucson, proudly presented by Crest Insurance Group, where we learn from and celebrate the local leaders, businesses, and nonprofit organizations who have stood the test of Tucson time. I'm your host, Matt Nelson of Crest Insurance, and I'm joined here virtually on Tucson Business Radio X today by Dr. Christian Moher. Dr. Moher is a family physician and the Chief Executive Officer of Escalera Health. And he's joining us this month to talk about really a number of topics, but they're going to center on employees' mental health at work in a post-COVID environment and how that relates to workplace culture for employers. So for those who don't know, Dr. Moher is a groundbreaking entrepreneur and one of Tucson's most respected physicians. He was pivotal in the development of local integrated care delivery models deployed by community partners and Sinfonia Healthcare through national agencies like Centene and Simpatico here in Arizona. And it was in this capacity as Chief Medical Officer for Community Partners that he was recognized in 2018 as the National Council for Behavioral Health Doctor of the Year. And this was around your work on the national opioid crisis, if I'm not mistaken, that also led to a TED Talk and your keynoting the white coat ceremony for your alma mater, the University of Arizona's Medical School. Is that correct?
That's right. Yep, absolutely.
And so since then, you've continued your work in our community at Escalera Health. It's a physician-led integrated healthcare clinic founded in Tucson as part of the Sunbelt Medical Group. And you and your wife, actually, I think you met at the U of A's College of Medicine. Is that correct?
That is absolutely right. Yeah.
And she's a family practitioner as well?
No, she's a pediatrician. So she's the much smarter doctor in the family for sure. So she works at Tanca Verde Pediatrics just up the street. Okay,
all right.
Yeah.
I know you guys are both strong advocates for the Tucson community, and among your busy schedule as CEO, physician, provider, public speaker, among other hobbies, you sing, play guitar, and keyboard in the local rock band Squirrel, which I'll definitely have some questions for you about as well. So,
excellent.
Really, thank you so much, Dr. Moher, for joining us. It's truly a pleasure to have you on the show, and I really look forward to this discussion. I just don't think it could be any more timely as we try and get to some sense of a path forward to have some guidance for employers and how they can interact with their employees in the best way possible. So, thank you. Really, really appreciate it.
Yes, sir. Thank you very much for having me.
Our pleasure. So as we all know, the past few months have been especially hard on the nation's workforce and employers amidst the COVID-19 pandemic. We started with some truly horrific images in cities where healthcare systems were struggling to meet and even in some cases losing the fight for capacity. And now we're in this environment where we've got concepts that really up until 6 months ago were completely alien for us, at least in the United States. Home confinement orders, public mask requirements, social distancing. And I think everybody has really been struggling to find some stable ground to stand on. And from a workplace culture standpoint, our society kind of fractured by COVID into two divisions, right? We had essential workers who had to continue working amidst an evolving situation. And then we had other workers who were compelled to stay at home by state actions that closed their businesses. And in the healthcare space, I mean, we even saw that divide happen within a single operation where you had half of the staff that was administrative being told to go home from a safety perspective, and then you have another half of the staff that has to go into the environment that they're being told that everybody knows is fairly dangerous. And I really would love to start with our discussion as we see these workforces starting to reconnect. It seems like there are a lot of unknowns about how employees are going to be reacting to these very different perspectives now on workplace safety and culture, now that everybody's kind of being put back into the same fishbowl after 6 months apart. And I really suspect we're not going to know the full implications of that for some time. But boy, as somebody who one of the rare people that has both a medical perspective on this and a medical education on this, but also you run a business and you've got employees that are in both of those camps. Maybe we can start off with how your organization was affected by this, and kind of how you're charting your path forward for your employees to get them back at work and not just present, but productive.
Yeah, it's an amazing question, and there's a lot wrapped up in there. I can tell you, just a brief introduction to Escalera. We are an integrated healthcare company. So we provide primary care services and behavioral health services. So on our staff, we have primary care doctors, nurse practitioners, and physician assistants. And then we also have psychiatrists and psychiatric nurse practitioners. And then we have therapists as well who see people for counseling, as well as all of our support staff. So when this pandemic broke, we really had to have some serious discussions as a company about how we were going to go forward. The primary care team definitely felt like this was in our wheelhouse and that we wanted to be out there testing, getting our community the answers that it needed to kind of move forward and stay as safe as possible. And our mental health providers wanted to continue doing the mental health work that they were doing, but weren't sure the best way to do that. So what we decided as a team is the mental health providers, our therapists and our psychiatrists, went mostly virtual. So almost all of them were doing telemedicine visits, which works great for mental health for a lot of people. So the physician or the therapist could be working from their home. The patient could log in from their home as well. And that system worked great, and it kept our people pretty busy. So because we were pretty sure we were going to take a hit financially when all this happened. We were sure our visits were going to go down. So that was one way that we found to kind of stay afloat during this time. We're a small company. We're not like the Banners and the TMCs of the world where we have these big war chests that we sit on. We make our living as we go as clinicians. And so we were able to kind of pivot our mental health team and have them being productive from home, which was great. There are challenges, of course, and not everyone has the same technology. Not all of our patients have smartphones or access to computer or internet, so we did have to do some workarounds for those patients. But for the most part, we were pretty successful with that. I don't think we were at full capacity, but we were probably seeing 70 to 80% of what we were seeing before on the mental health side, which was enough to keep us afloat, which is great. On the primary care side, it's a little different because I can't listen to someone's lungs or listen to someone's heart over the phone. I've got to see them in person if they're having symptoms or if there's a painful ear or there's some other problem. So we needed to have some clinic hours for sure. So we stayed open for that. And then we also I had telemedicine hours available for primary care as well. A lot of things we can do over telemedicine if you're managing someone's diabetes or if you're managing hypertension and they've got a way to check their blood pressure at home, then we can do a lot of that over the phone. And some of our patients really appreciate that. And there's a lot of patients that you really don't want in a doctor's office or a hospital setting because they have so many other medical problems. We were able to get both of those things up and running. And to be on the safe side, like a lot of companies, we were really concerned about what the financial impact on our company was going to be. And so we all took pay cuts. This is in March. I want to say maybe the second or third week in March, as we kind of saw what was happening in the world and where this was headed. So we across the board, everybody took a pay cut. And some people were not super happy about that. And most of us were just kind of tightening our belts and going to make it work. Fortuitously, around that time, we have a lab that we work with that does our in-office blood draws for all of our patients. And they were very interested in starting aggressive COVID-19 testing for the community. So I would say by the second week of March, we had a drive-up tent up and running at our facility. So we were able to start doing the nasal swab testing for patients to start screening for COVID-19. And over the last 8 to 9 weeks, we've screened probably 2,500 patients through that clinic already. And then we also have the blood tests available in our clinic for antibodies. And then a more recent line of business that we've been able to develop is our COVID-19 response unit, where we'll go to employers who need to have their people tested. And so we've gone to restaurants and mortgage companies and several medical clinics to go and bring our crew with us. And then we kind of set up in a big conference room where we can socially distance appropriately and we get as many people tested as possible. So just this week, I've probably screened 400 people myself this week, going to several offices, and it's only Thursday. So we're pretty tired, to say the least. But I will tell you that because of how successful we've been with our COVID screening business, that we were all able to go back up to our regular salaries across the board so we really missed one pay period where we had lower reimbursement for our staff, and then now everyone's back up and above that. So that being able to kind of step into that gap and provide services to the community ended up being a really good line of business for our company as well.
That's fantastic. Well, and so as you look at, we're starting to get to the point where, and there's, of course, in an evolving situation like this, everything it's a battle of inches, right? You make some gains, and then some new information comes out, and you realize, okay, maybe we weren't quite as far along as we thought we were. And then you go back and you retool and you make some more gains. And so, but as more data becomes available, and as an employer, you're able to start to make more informed decisions around risk management and what a business looks like, what a workforce can look like, how your employees can work together. I guess from the perspective of somebody who's out there getting the data, how have you seen that affect the elements of your workforce that are now kind of coming back and combining and then going out into a community where previously we were kind of flying blind and there was a range of options from this, we're never going to be able to go back to normal to maybe we'll be able to get some approximation of it to you've got some arguments saying, hey, look, like if things trend extremely positively, it'll be just like the flu. And I don't want to open that whole can of worms, but from a workforce management standpoint, from a culture management standpoint, how do you adjust your business and adjust employees' expectations around data that's evolving this quickly? Because I don't know that there have been many workplace culture situations that have had this much variation in this short of a time.
Right. Yeah, absolutely. And it is a challenge as we are learning more about this virus. Literally every day, new things are coming out. And so, we're doing all this testing and we're not really sure, number one, how good those results are. I think the test results are pretty good, but we don't necessarily know what the implications of those results are. We know that if someone tests positive for active disease, and that's a pretty good test, and then they probably do have an active disease. What we aren't sure on is when we do the antibody testing and the antibodies come back positive, meaning that someone has had this illness, has gotten over it, and then their body has made an immune response. We're sincerely hoping that really makes them immune to it, like it does when you get the flu or you get, your shots when you're a child. But we don't have that answer yet. We don't know if someone is antibody positive, are they really immune? Or if they are immune, how long does that immunity last? And so this all plays into workplace reintegration. How do we get people back to work? How do we get people feeling comfortable about going back to work? I just did a Zoom conference with the leaders of FC Tucson and all their youth soccer academies, because they're starting back up again, and these kids and parents and coaches and support staff are all worried about how that's going to look, and the way that kids and teenagers process information and process the world is in some way different than adults do, but it's also very similar. Some kids are scared. Some kids are irritated that they had to not do the things that they wanted to do. And some are really, really frightened about potentially catching this illness and bringing it home, either getting sick themselves or bringing it home to someone that's ill. And in talking to our staff, those are all the same concerns that we have. Every person has a slightly different social situation. Some of us I have teenagers at home, and their lives have been significantly disrupted over the last year. My son's home from college. He's doing it online, and my daughter will be a senior next year. So she's worried about what her senior year in high school is going to be. And then you have other staff members who have an elderly parent at home, or someone who has another, or maybe a spouse who's got a significant medical issue. And we are all very worried about bringing this stuff home. Certainly in the medical community, all the doctors that I talk to and the nurses and the nurse practitioners and PAs, we're super worried about, we feel pretty good, but are we bringing something home to our families? Are we bringing something out into the community when we do see people? So we're taking every precaution to do that. I think that from a company standpoint, our culture has been that we really want to empower people to make decisions that are the best for them and their family. If someone is able to work virtually, meaning that they can do their work from home, then we want to empower them to do that, to keep them as safe as possible physically, but also mentally. If a lot of our therapists are not used to dealing with medical health problems, and so it's the idea, just the possibility that they could get sick from someone that they're seeing and trying to help, and then bring that home to their children is very scary for them. So we've had several staff meetings talking about this and trying to find out where people's comfort levels were coming back to the office. And over the last couple of weeks, we're kind of slowly starting to reintegrate most of those people if they're feeling comfortable. There's a couple of the therapists that are just going to stay virtual for now because that's where they feel the best. From a company standpoint, it's a great, and it's also a challenge. There's some infrastructure things you need to have as far as computers and good internet connection and all that kind of stuff. And then there's also the financial aspect of that. Like if productivity goes down for someone, and how do you deal with that? Because in reality it does. There's some headaches in dealing with the electronic things, and sometimes patients don't show up or calls get dropped and that kind of stuff. And how do you bill for that? And how do you compensate someone appropriately for their work they're doing? But also on the other side, they may not be bringing in as much to the company. So that's a challenge that we're dealing with on a daily basis, but we're slowly working through that.
I think a little bit about, so I took the time to listen to the TED Talk. And so your involvement in the opioid crisis, I think, was a great, I'm going to say the word mea culpa, but I don't think it really applies, because it was kind of one of those situations where, we thought we understood a situation. We thought we knew what the right thing was to do in our medical community, in the healthcare system. And then as data evolved, we started to realize that there were problems, right? That there were second and third order effects that we just hadn't fully understood. And so all of a sudden, you're faced, and in a position of authority, this is especially difficult, right? Because now it's very difficult to have to turn around and say, you know what, we got this a little bit wrong. We need to change course. And I think it really is a testament to your character that you were somebody who openly stood up and said, you know what, no, we need to change course on this prescription model for opioids. And we have to fix this, because the consequences are going to be dire if we continue on this path, because of all these other motivations that have kind of gotten us here. And so it just seems like your experience is particularly relevant as we look at this situation right now with this evolving COVID crisis, where we have conflicting interpretations of evidence. We have models where, hey, you know what, we got something wrong there, and now we've got to try and walk that back and retain the trust of not only our community, but as an employer, you got to maintain the trust of your employees and maintain that connection. Because I think one of the things that really stood out to me when you were talking about how you manage somebody that's struggling with an opioid addiction, the importance of connection, right? The importance of connection and integration, both in their healthcare, because it's not something that's happening in isolation, but also social connection. And that seems to tie very closely to what's alien to us right now, which is we've had these bonds of connection in the workplace and in our communities, sometimes even in families. If you have an elderly family member where it's not seen as safe right now to be around them, how, when you look at that experience and you try and apply that now to the practices you're doing in the workforce, where you have people that have some physical restriction where they're going to be physically distant, either through technology or just through having to wear a mask all day or having to stay 6 feet apart while they're in the clinic. How have you guys as an organization tried to keep people connected? I heard you mention kind of regular staff check-ins. If I run a manufacturing company, what things do you think I could take from that and try and incorporate?
Yeah, so absolutely. Yes. So I think connection is a huge part of that. And there's lots of different ways to do that. And that, that's from the bottom all the way to the top, so my company is relatively small. We probably have 30 employees. So it's very easy to stay in contact, and we see each other almost every day, those of us that are in the office. It has been a challenge, especially for our therapists who tend to be more sensitive anyway, and definitely more empathetic to people. And therapy is such a challenge because you really take in a lot of what you're talking to your patient, your client about. And if you don't have a way to express those thoughts and talk with your peers and feel like you have a good support system around you, then we all do really kind of internalize that. And then you're carrying even more than you normally carry on the inside. So it is a huge challenge. So what we've done is like I said, we try to maintain regular staff meetings. We try to do fun things. Like we all got, I got t-shirts for everybody that said COVID-19 response team, kind of as a team building experience to let people know that they're not alone. I think the experience, with the opioid epidemic, I do think it's not improper to say that it's a mea culpa, because I do think that we did not have our eyes on the ball, and that we were misled in some ways. And we also kind of let us get carried along by the pharmaceutical industry, and we kind of let ourselves get carried along by, to quite honestly, the money. It's a good business model to have patients coming back and seeing you every week or every month. It's not good for the patient necessarily, and it's really not good for our system of care. And the data that we used back when I was in training, that in the 90s, I graduated med school in 99. Then I did my residency at Oregon Health and Science University in Portland. And so we were trained that pain is one of your vital signs, that pain, you have your blood pressure, your pulse, your oxygen level, and your pain level. And the problem with doing that is that you and I could have the same painful stimuli, and I could be in pain that I rate 10 out of 10, and you could be in pain that you rate 1 out of 10. And so how do you deal with that as a patient? Because my feeling of being 10 out of 10 is really a valid feeling for how I feel, and your feeling of feeling 1 out of 10 is a valid feeling for how you feel. But how do we treat that? Does that mean I need to be on, extended release morphine for my pain that you don't need to take anything for? And it's a huge challenge in trying to deal with that. And I think, as pain is the 5th vital sign, and patient satisfaction scores and all these things became a part of how we were rated by insurance companies and payers and stuff, then we really started building our practices towards that. We tailored our electronic health records to more meet the demands of the payment model than we did to be really good health records, to tell the story of what was happening with the patient in medical terms, as opposed to checking boxes that we need to check. Did you address smoking this visit, or did you talk to someone about their BMI or their body weight? And so I think that trying to deal with all that of those external pressures is really challenging as a physician and as a business owner too. I'm sure you deal with it too. There's so much regulation in your work. There's so much regulation in my work that sometimes I feel like it gets in the way of our mission. It gets in the way of what we do, but it's also the price of doing business. And so from a cultural standpoint at our work, we really try to make sure that we are, it's part of our mission statement that we use intentional kindness. We try to bring kindness to every interaction we have. And that's with staff members, that's with peers, that's with patients, that's with payers, that's with potential business out in the community. We try to be kind first. And I think that generally resonates with people. And sometimes it's not always the best business move, but I think usually kindness does pay off in the long term. And then we try to make sure that we're financially sustainable. That's otherwise, if you don't have the bottom line, then you don't have your vision, you don't have your company. And so we really try to work with that. And Sunbelt has really been very helpful in helping us kind of manage our business, manage our billing, so that we can complete our mission. And then the last thing, we really want to have innovation, and we call it rockstar innovation. It comes from my musical background, which I'm sure we'll talk about in a bit, but we really want to innovate. We want to, there's a lot of doctors' offices, patients can go see a doctor or nurse practitioner all over the place, but what makes our company unique, and what do we bring to that? And it's our culture of how we take care of our our staff first and foremost. To me, the staff is the most important. And if you take care of your staff and you validate their concerns, then they are going to take care of your patients and your clients, and they're going to validate their concerns.
That makes sense. And, I'm actually glad you couched it that way, because I think oftentimes so one of the things that I was trained on, in business school is like, everything's customer centric, and then you kind of build the staff to meet the customer. And I think as data has evolved, one of the things that we've come to realize is that, well, all right, you can like your relationships with your customers can evolve much more quickly than your relationships with your staff. It's a lot harder to replace good staff than it is to say, you know what, maybe this is not the right customer for our organization, and place your priority on the staffing side, making sure that everybody is in line with the mission and the culture, and then going out and finding customers that respond to that, as opposed to trying to constantly change your business model. And I mean, there's a balance, like anything, right? I mean, I think that dichotomy is something that gets lost a lot of times in conversation, where, sometimes new data comes out and that dichotomy has to shift. And, if there's one thing that's constant in life, it is that dichotomy evolves.
Yeah, for sure.
So I'll tell you what, since you brought up music, let's take a quick, we started off with some fairly heavy topics. So let's take a quick breather here. So you grew up in Michigan. Go to Oral Roberts, which is in Oklahoma, for your undergrad. What brought you to Oral Roberts first, and then what brought you to Tucson, to the U of A College of Medicine for med school? Was that intentional? Was it something that, it's like Michigan was cold and snowy and Arizona looked like sunny and palm trees? Because that seems to be, that's where you met your wife, and then, we'll talk about music from that. Yeah. So how did that story go?
So yeah, it's a great story. So when I was growing up in Michigan, I was pretty conservative. I was raised in a pretty conservative family, and I went to a religious high school. And the girl I was dating at the time went to Oral Roberts, which is in Tulsa. So I thought, well, I might as well tag along. And like many stories along those lines go. It did not end great from a relationship standpoint, but it was a good place to go to. I was there at a really interesting time to be there, which was during the crisis. I don't know if you remember this, but where Oral Roberts, and I didn't really know who Oral Roberts was. I really wasn't into televangelism or any of that kind of stuff. I just went basically for this girl. But I was there when he said that, if he didn't get like $1 million and he was going to die, like God was going to call him back. So it's a really interesting time to be there. And I can tell you that I certainly went into that school with an idea of what my life would be and what my views on the world were and what my religious views were. And I think unlike a lot of people there, I think I really went the opposite way once I was there. So I had a really hard time reconciling my worldview with that worldview. And it's not that there's anything wrong with that worldview. There's a lot of people that I really love that have that specific worldview. It just didn't necessarily resonate with what I feel on the inside. And that really showed itself in a lot of ways. I tended to be more creative. I went into my major is in English literature. So I studied a lot of literature. I did a lot of reading and a lot of writing. And I admit freely that a lot of that was because I was terrible at math and I wanted to avoid math in any possible way that I could, but also because I seem to have an aptitude for it. And so if you've been around English departments at all, they tend to be creative folk, and they tend to be kind of on the fringe of what I would say most faculty were. And I had some amazing faculty members, one who was a D.H. Lawrence scholar, which you wouldn't necessarily expect to find at Oral Roberts University, but a lot of people like that. They really exposed me to a different part of the world. And then I worked the whole time I was in college. I worked full-time at a restaurant. I started as a busser, and then I was a waiter. And I was exposed to gay culture in a way that I had not been exposed before. And my preconceived ideas of how people who happen to be gay were going to be were entirely shattered as I realized that everybody is exactly the same, and everybody has the same fights with their boyfriend or girlfriend, and everyone has the same fights with their boss or has the same things that they love and hate. So that experience was really eye-opening for me. And then the biggest one for me was I went on a mission trip to Africa. I was in Ghana for a while, and I really had a difficult time reconciling that these people were going to not not be taken care of after they passed away if they didn't believe a certain way. So this is just for me. Again, I'm not judging anybody's beliefs at all. This is just for my system. And so when I came back, I really had to think about what I wanted to do with my life. And so I graduated with a degree in English Lit. And so the answer was not much at that particular point. There wasn't a lot I could do with that. So I moved back to Michigan for a year, and I worked construction at that time. But then I applied to law school and got into law school in Michigan, but I really did not want to do it. I kind of was just doing that as the next thing I was going to do in my life. And I, woke up one morning and realized I really didn't want to be a lawyer. And so my dad lived in Tucson, and he had been a doctor in Tucson for a long time. So I decided really on the spur of the moment that I was going to move out to Tucson and kind of not go to law school, because I could see what was going to happen to me if I was in law school, and I wasn't going to be happy in 10 or 15 years. So I really just wanted to make a break and kind of reassess. So I drove cross country and ended up in Tucson, and this is in the mid 90s. And then I worked at the Olive Garden at Tucson Mall for a long time, and was able to buy a house and a car and everything. That place was very, very good to me. And then I was in a movie theater at the Century. I think it's called the Century Park. It used to be by I-10 and Grant. It was a big movie theater there, and I was watching this movie called The Doctor with William Hurt, and I was sitting in that dark theater by myself, and I was like, I really want to be a doctor. And I'd always wanted to be a doctor, really. My dad and my stepdad were both physicians, but I don't know what it was like for you with your dad, but I really did not feel like I could ever measure up to them from an intellect standpoint or from a work ethic standpoint. So I really took being a doctor off my plate as something that I could possibly do. But sitting in that theater, I really realized that was my calling. And so then starting that next day, I re-enrolled at the U of A and got all my prerequisites done, and then ended up getting into med school in 95. Met my wife the woman who was going to become my wife, met her within the first month, and we became study buddies, and yada, yada, yada. 22 years later, we've been married for 22 years now. We've been together for 25, 26. And so it's been great for me. And living in Tucson is awesome. And my wife's from Tucson. We love Tucson. We raised our family here, and it's the best possible place for us. And so that's kind of how I ended up in Tucson. We left a little while for residency and moved up to Oregon for 3 years, and then moved back to Michigan, where my stepdad had Lou Gehrig's disease, ALS, and we stayed until he passed away. Then we always knew we wanted to get back here to the warm weather and the beautiful people and culture here. So that's how we ended up back here.
That is quite the path to a career in medicine. That's my goodness. We could probably talk for an entire hour-long podcast about that, because it's it's amazing. So I'm the lone member of my family that is not in the medical field. My brother is a PA up in Phoenix. My sister is a nurse up in Washington. And so as the evil insurance guy over the table at Thanksgiving, we always have some interesting conversations about the world. But what's amazing to me is quite frankly, you don't see many people who are English Lit majors that decide in a movie theater, hey, you know what, medicine is something I want to take a crack at. And quite frankly, they have the ability, the discipline, and the intellect to make that more than just a passing thought over popcorn, where it's like, oh, I'd be nice to be a doctor. So,
well, listen, I will tell you that no one is more surprised at that than me, that it worked out all right. So I would tell you that there are many teachers and my parents that would have never thought that this was going to be a possibility. So I'm very, very thankful. Yeah,
that's fantastic. Well, I'll tell you what. So let's take a quick break here to kind of catch anybody up who might be joining us midway through. So for those of us that are just joining us, this is Culture at Work in Tucson, proudly presented by Crest Insurance. As the largest locally owned and operated insurance brokerage in southern Arizona and one of the top 100 insurance agencies in the United States, Crest is your hometown broker to assist with your commercial insurance, workers' compensation, and employee health benefit insurance plans. I'm your host, Matt Nelson, and now back to our conversation with Dr. Chris Moher. So as we so you're in Tucson, and I guess we'll throw one more kind of softball question up here. How do a physician and chief medical officer, a pharmacist, a former Army first sergeant, a chief financial officer, a venture capitalist, and two other executives decide to link up and start a rock band. So what got you guys started? Well, I guess you in music first, but then how did that motley crew of business executives get together to start playing music?
Yeah, that's a really good question, and yes, obviously we are one of the great rock bands in the history of music. So it's a very important question that needs to be answered, Matt, for sure. So I started in music when I was a kid. I certainly did piano lessons like everybody else did. I was a terrible student, and you will. As we discuss my history in college and high school and everything, you'll find I was a pretty terrible student at everything that I did until I really decided what I wanted to do. So I was not a great piano student. I played French horn in high school too. And then when I got to college, I bought a buddy's guitar, and I kind of taught myself to play guitar. I'm not a great guitarist, but I can play and I can survive a little bit. I'm much better at keyboard, but I play mostly by ear. And so I had played on and off for a long time, I'm 52. So for the last 45 years or so, I've played. And then it's a funny question because I worked at Carondelet out by St. Joe's Hospital for many years when I first moved back to Tucson. And I had read, and this is going to be it's kind of a circuitous story about my career and then how I got into the band. So, but they're kind of all connected. So I had read this article in the Daily Star, about Fletcher McCusker, who is a lot of your listeners will probably know. He's a big businessman downtown. He's been very successful in everything that he's done, and he runs a venture capital company now down there. And he was starting a home health and hospice company that was going to be integrated. So they're going to have primary care, some behavioral health. They had an oxygen company too at the time. And so kind of a unique situation. And I had got on to their website, and they had a chief nursing officer and a CFO, and they had a lot of leadership positions, but they didn't have a physician at all. So I was on the board of the Children's Museum at the time, and I very illegally got his email address from my executive director, because Fletcher and his wife Liz are big donate. They donate to everything. And so I got his email address, and I emailed him out of the blue, said, "Listen, I'm a doctor in Tucson. I would been the team doctor for the Tucson Padres for the last couple of years. I've done all this other stuff in Tucson. I love Tucson. You love Tucson. Maybe we should get together and kind of talk about your company and stuff." And I guarantee that Fletcher gets that kind of email probably 30 times a week from people who want to work with him somehow. But for whatever reason, he said, "Yeah, why don't you come on down and we'll chat." And so I came down to his office, and it was, Matt, you said you've been there, but it was basically it used to be the old produce warehouse that was on Toole and Stone, right when you come up that underpass there. And I walked into this building, and it's, 40-foot high ceilings and exposed brick everywhere. And they had a basketball court set up. And then they had this rock band set up at the front with a full drum kit and a bunch of guitars and a piano and stuff. And in my brain, I was thinking, I will work here for free. I will volunteer to lead this hospice just so I can come and hang out in this office. I did not tell Fletcher that, thank God, at the time. But so he and I met, and we kind of chatted, for probably an hour and a half, maybe 2 hours in his office. And Fletcher is really interesting. And I think a lot of really successful business guys are like this, or businessmen and women are like this. And he's very intuitive, and he had a gut feeling about me that I don't even know why he had it. But, so I left that interview not sure what was going to happen. But he called me an hour later on the phone and said, "Listen, I'd like to make you my chief medical officer." And that was totally out of the blue. He really didn't know me. He didn't call any of my references. He didn't know anything other than the conversation that we had. And I really owe a lot to Fletcher, and I appreciate him, seeing something in me that I hoped was there and that I really wanted to nurture in myself. And so we started a company at that point in time, running home health and hospice out of downtown. And then what I didn't know is that Fletcher, before he started this company, he'd been a part of Providence, which is a big behavioral health services company for kids. And when he left that company, he had a no-compete clause to not go into that line of business for a certain amount of time. And after I'd been with him for about 6 months, that no-compete clause was up. And, business people can hold grudges, or they can have a fire burning in their heart. And so as soon as literally the day that was up, we started our integrated health company at that time to kind of get into that line of business, because he really felt like integrated care is what we should all have. Primary care, behavioral health together, it makes so much sense. If your mental health is not great, your physical health is not going to work. And if your physical health isn't great, your mental health is going to suffer as well. So I think we were really ahead of our time, and we started a company called Assurance. And I'm going to fast forward past a bunch of stuff, but in 3 years, we grew from 1 clinic and 0 patients to we had 21 sites and about 10,000 patients and about 500 employees throughout Arizona. So we grew really, really fast. And then there are some amazing things about growing that fast and some really terrible things from growing that fast, especially from a business culture standpoint. I can tell you that when I'm running meetings every week and I know everybody that I work with and we all work very close together, it's very easy to maintain our culture of communication and validation and support and kindness. When we got 10,000 patients and employees that I've never met scattered all over the state, it's a lot harder to maintain that. So we had some growing pains with that. But back to the more important thing, which is the band. So Fletcher and his friends, had started this band, and they had named it Squirrel. And I was around kind of at the beginning when they named the band, and I just want to go on the record, and this is a behind the scenes story that you will only get here on Matt's podcast, is that we actually had a party down at that building to kind of name the band. And we had tons of people there that had come up with all these awesome names. I'm not going to go into what they all were, but they were all awesome. And every one of them was better than the name Squirrel, which is what we ended up having, which is spelled SQWRL. And we're on iTunes and stuff if you really are bored and you want to listen to us. But they ended up with the band Squirrel, the name Squirrel. And it's basically because of that movie Up, when that dog, whenever he sees a squirrel, like he looks away really quick, because we were all very distracted by shiny things. So Fletcher had this band running with his CFO, Michael Deitch, our lead guitarist, Tony, our bass player, Kevin, and then our lead singer, Jim. And we had another woman named Amy who sang with us at that time too. And I kept trying to get into the band. And every time I met with Fletcher, I was like, you really should let me play with the band. I'm a decent keyboardist. I'll bring my own stuff. I'll carry people's bags. All I want to do is a chance. And he kept putting me off, excuse me, because I don't think he really thought I could play. And then he finally invited me down one Sunday morning, and I played, and then the rest is history. And we played a lot of gigs together. Certainly played Second Saturdays or Downtown Saturday Night. We played at the Fox several times, and Club Congress, and a lot of other parties and stuff like that. And it was an awesome experience. And Tucson is a great music community. It's a great medical community, and a lot of medical people play musical instruments. And so it was a natural fit for me. Fantastic.
That's when you talk about integrated healthcare, and I'm going to make a fantastic segue here, because I'm going to tie integrated healthcare to music. But so one of the things that I think a lot of people, and you touched on it a little bit, when they hear integrated healthcare, it can mean a couple different things depending on who you're talking to, right? If you're talking to somebody from the payer side, we might be talking about it from the standpoint of maybe it could be something like within the confines of a patient-centered medical home, or it could be something within the confines of just basically a facility that has a behavioral health side and a primary care side. And I think from a data perspective, and I think this actually does tie to a culture discussion, but for a long time we've kind of treated a lot of things that as if they're separate and undervalued them as a component of a larger construct, right? So like primary care is a great example of something that you talk to anybody who's informed, I think, in the insurance industry on the payer side, looks at the valuation of primary care from a reimbursement perspective. But then you look at the return on investment in primary care from a case management standpoint and ultimately a cost of treatment standpoint. And, insurance companies get a fantastic bargain on primary care that unfortunately goes very underutilized because the incentives aren't always aligned that way. And then you take that and then you multiply it by about 3. And I think that's where we wind up with behavioral health. And so I guess from a business perspective, first off, bold go of it to take the two of them together and try and get paid on it. But when you look at it kind of as something where you're innovating on the fly, you're trying to meet your patients where they're at. across a spectrum of potential issues. You've got mental health issues. You've got issues of access to care that materialize, I think, in primary care more than really anywhere else. You don't see, quite frankly, the complaints about access to care don't often rise to the level of a cardiologist, for example, whereas a PCP is addressing that on the front lines. So basically, as a business, you're making a go of it as a business in two areas of the healthcare system that are kind of critically undervalued, but extremely important. What lessons do you take from your experience talking to patients who you're trying to meet them where they're at, behaviorally, from a primary care perspective? What lessons from that do you take into your business and how you interact with your employees? Because you do kind of hire people where they're at as they are, and you're trying to adapt a business around a team. How do you do that? And if you were talking to an employer that's saying, hey, I'm trying to understand what integrated healthcare is. Why is this important in our healthcare system? But B, are there lessons that I could apply to my business, even if it's not in the healthcare space, about how I interact with my employees? Is there something, some ground to run on there that you think you could bring from your experience?
Yeah, absolutely. I mean, I think you got to go back into how we have separated healthcare in this country over the last 30 or 40 years. There was a time where mental health and primary care were separated into these different silos. And I think that was the start of a lot of our health crises problems that we're having now. So for whatever reasons, and we're not going to call the insurance companies the bad guys, it just happened. We're all very busy with stuff. And so you had your mental health care at this one place in this one silo, and you had your primary care in a different place. And very, very rarely would those two sides interact. When I was a primary care doctor at Carondelet, and Carondelet is a great company, it has nothing to do with them. When I worked there, I can say I was there for probably 12 years, and I talked to a psychiatrist twice in those 12 years. And that's just as much on me as it is on the psychiatrist. I did not ever call a psychiatrist. Both those times was when the psychiatrist called me to talk about a patient. That doesn't work. I mean, that doesn't work for patients, and that puts patients at risk of significant medical and mental health problems. Like if I am writing medications for a patient and I don't know what mental health medications they're on, there can be significant interactions between our medications. And the same goes for the mental health provider. And if I'm seeing a patient and I don't have context for what they're going through socially, are they getting beat up by their spouse? Do they not have a place to live? Do they not have food in their pantry? Those are all things that really impact physical health. And in a 15-minute visit, it is very difficult for me to get into when I'm trying to get on top of your sugars are 300 and your blood pressure is 180. I don't have time to worry about where you live right now. But really, if someone doesn't have a good place to live and they have food insecurity and they're in a marginalized group of people that doesn't have access to care, then all those things are why their blood pressure and their blood sugars are so high. So as a society, we really have to get to how we're going to address those things together. But when we separated mental health care from primary care, we did a big disservice to the patient, and we did a big disservice to medical providers, because we live our lives in isolation, much like many of us in this coronavirus time have been doing at home. Like, we need social interaction. Humans are designed to get some satisfaction, to get some release of dopamine from interacting with other people. And when we're at home and we're interacting with people through screens or not interacting with people at all, then we are missing something. And that we feel that as a sense of unease, as a sense of anxiety, as a sense of fear, as difficulty sleeping, as eating too much, eating the wrong things, drinking the wrong things, or taking the wrong things, or not eating much, not eating enough, not exercising enough, not taking care of ourselves. All those things that happen to people with really significant mental health problems, medical problems, happen to us who don't necessarily have those issues, but when we're in isolation. And so we feel that putting primary care doctors and mental health doctors together gets the best outcomes for the patient. It's not just me that feels that way. SAMHSA, which is one of the big mental health organizations in the United States, feels that way too. And when you combine primary care in mental health care and substance abuse care, you get the best outcomes at the best costs for everybody. So from the insurance standpoint, and from the medical standpoint, we want the best outcomes for lower cost. And we also want to have engagement from our patients and engagement from our staff. And we want it to be a good experience. So from a cultural standpoint, how we try to design the patient experience is that people feel connected, they feel heard, they feel validated, they want their friends to come here, they want people to say, I can't believe I just met this doctor and they actually listened to what I had to say, and they weren't just worried about checking boxes or the other things that we all get very busy doing. I can tell you that I'm pretty old school. I do not bring a computer into the room with me. A lot of the younger doctors I work with do, and there's nothing wrong with that. But I find that I get distracted if I have a screen in the room with me and a patient. I find I really don't want the patient to feel like I'm worried about anything else but what they're saying to me, and that I want them to know that they have my full undivided attention. And so I bring in a piece of paper, and that's all I bring in is an empty piece of paper. And we kind of sit and talk about what happens next. And sometimes that's a problem. Like if I need to know what their last labs were and I don't have them right in my brain, then I have to step out and get them. But for the most part, it makes it work. And that seems to be why patients come to me. There's lots of reasons why patients come to our other providers who are all very good, and they just have different styles. One thing I think culturally that we try to do is be a place where all those different styles can work. My style works for me. That doesn't necessarily work for someone else. And so we want to make a place of work where that individual style can be used, as long as we get our work done. Now, at the end of the day, you got to get your work done, and we all do. We just come about it in a slightly different way. I
previously was in the military, and so I spent 9 years in the military. One of the things that we talk about within the confines of a unit is, on the essential items, we're united, and then on the items that surround that, you're tolerant functionally. I mean, like you create space to allow people to be different, but so it seems culturally, it's kind of funny when you see touchstones of successful organizations. Oftentimes, it's funny how much they boil down in common. They're just applied differently. But you said something, I think, that really around the patient experience that really seems like a great cultural nugget, which is kind of being intentional about making sure that people have time to feel heard and acknowledged, which is difficult, right? Because everybody's got demands on their time, and everybody's trying to row as fast as they can. And so it's difficult sometimes to say, all right, this is the point where we need to put our oars down and check in and make sure we're all still going forward. How do you do that within the confines of Escalera? I mean, you've talked about kind of meeting check-ins and things like that. Is it something where it's institutionalized? Is it something where it's a bit more kind of ad hoc, where it's, hey, I'm walking around and checking in with people as I see them? And then if it is a blend of those, what do you look for? Much in the same way that I would expect you probably signs you look for in a patient when somebody's talking to you to say, all right, is this an area where I need to ask some more questions? How do you do that?
Yeah, it's a fantastic question. I think, as a relatively small employer of, 25 to 30 employees right now, it is easier to do it walking around, knowing everybody's faces, kind of getting to know everybody's mannerisms, and then being aware and hopefully astute enough to realize that if someone's being short, if someone's distracted, then those are times to reach out and kind of find out what's happening. I am not always the best person to do that. We have other people on our staff that I don't have that. What I mean is I don't have that relationship with everybody that I feel like I'm the appropriate person to talk to them. But we do have an open line of communication with our executive team so that the right person is able to get to talk to that person. So if I have a concern, I will talk to my chief clinical officer, Robin Glicksman, who is kind of in charge of our personnel and has a very close relationship with our staff. And so she is more likely to be that direct communicator with that individual person. And we all kind of try to keep an eye on each other. I can tell you that with the COVID pandemic, it has been much harder to do this. Yesterday, between 1:30 and 7, we screened about 150 COVID patients at 3 different sites. And so there's not a lot of time in those interactions, which are often a minute or two long, to make a patient really feel like you're hearing them. So we do our absolute best, and you can still be open, and people can still get a sense of what you are and what you're about, from that first impression, from those first seconds you meet someone. We've all made 100 deductions or judgments already. And so we really try to have an overwhelmingly positive attitude, not just with our patients, but with our community, with our payers, with our staff and our patients. And kind of, the brand that we kind of have is I think, Culinary Dropout is an amazing restaurant here in town. And I think Sam Fox and his line of restaurants are amazing. And each one of his restaurants has kind of a unique presentation and a brand culturally. For me, personally, I have a lot of tattoos. I wear black T-shirts all the time. And that is kind of my brand, is that I want to be known as someone who doesn't look like the typical doctor that they see every day. A lot of my patients have tattoos. A lot of people feel like they've had to cover them up in doctors' offices before, and they don't feel like that in our office. We try to make sure that our patients feel welcome, to use your word, to meet them where they're at. And for a lot of patients, let me put it this way: doctors have a long history of thinking pretty highly of themselves, and I think that comes through to patients. And if you can find a provider who doesn't, who takes themselves with a sense of humor, and also, likes to talk about music and video games and all the things that I like to do outside of medicine, then that's how we bond with patients and our staff. And so that's how we've been able to kind of get our culture going and hopefully maintain it. I think, to your point, as we get bigger and as we expand, and what's happened before, we need to get to we need to figure out how we're going to do that as an institution.
Well, I think, kind of in closing, there are a couple great things that you said there, but if I was to put a bow on it, and let me know if you agree, but it seems like if we can be intentional about being kind, kind of giving people a space to feel comfortable, and just being intentional about being connected and on the things that make us unique and make us human. It seems like, from a cultural perspective, at least, those are some pretty solid guidestones to carry us forward as we adapt and try and get back to some semblance of what life was before. Would you say that's a fair way to summarize?
I agree, and much better than I could put it, for sure. Yeah, that's perfect. So,
well, Christian, thank you so much. I really appreciate you taking the time. If somebody wants to find you, the TED Talk or LinkedIn or Twitter, yep. I think Twitter, your side, is it Side Hustle Doc?
Side Hustle MD, sidehustlemd.com. And certainly, if people want to email me or reach out to me, my email is christianmohrmd@gmail. And so it's CHRISTIANMOHERMD@gmail.com. And I'm happy to take emails and questions and we love Tucson. We love the community, love what this podcast represents, and really want to make Tucson the best place to work and the best place to live.
Well, thank you so much. Really appreciate it. Thank you again for the time. And for all of you that are joining us, thank you for taking the time to listen. We'll catch you next month. Culture at Work at Tucson. This is Matt. I'm signing off.
Join Matt for another interesting Culture at Work podcast right here on TucsonBusinessRadioX.com.